Welcome to my stomach YouTube channel. My goal is to empower you with the knowledge and tools you need to take charge of your tummy health and start living your best life. So subscribe, hit the notification bell, and let's get started on this journey to optimal gut health. Today we will be exploring into irritable bowel syndrome. Let's dive in. What is IBS? IBS is a chronic condition that affects the digestive system, specifically the large intestine. It is classified as a functional gastrointestinal disorder, meaning that it doesn't cause visible damage to the digestive tract but affects how the gut works. Individuals with IBS experience recurring symptoms such as abdominal pain, bloating, diarrhea, and constipation. These symptoms can range from mild to severe and may fluctuate over time. Importantly, IBS is not a life-threatening condition, but it can be debilitating and significantly reduce the quality of life for those who suffer from it. Types of IBS. Here are several subtypes of IBS, categorized based on the predominant bowel habits experienced by the individual. IBS with diarrhea. IBSD. This type is characterized by frequent episodes of diarrhea. Individuals may experience urgent and watery bowel movements, often accompanied by abdominal pain and cramping. IBS with constipation. IBSC. In this subtype, constipation is the primary symptom. Individuals may have infrequent bowel movements, hard or lumpy stools, and difficulty passing stools. IBS with mixed bowel habits. IBSM. People with IBSM experience alternating episodes of diarrhea and constipation. The symptoms may shift back and forth, causing significant discomfort. Subtype IBS. IBSU. In some cases, individuals may not fit neatly into the above categories, as their symptoms vary widely without a clear pattern. Understanding the type of IBS a person has is essential for determining the most appropriate treatment plan. Symptoms of IBS. The symptoms of IBS vary from person to person and can fluctuate over time. Some individuals experience symptoms daily, while others may have flare-ups that come and go. The most common symptoms include abdominal pain and cramping. This is the hallmark symptom of IBS. The pain is often described as a cramping or aching sensation in the lower abdomen. It may worsen after eating and improve after a bowel movement. Bloating and gas. Individuals with IBS frequently report feeling bloated, with a sensation of fullness in the abdomen. This is often accompanied by excessive gas, diarrhea, or constipation. Depending on the type of IBS, individuals may experience frequent, urgent bowel movements, diarrhea, or infrequent, difficult bowel movements, constipation. Some people alternate between the two. Mucus and stools. People with IBS may notice mucus in their stools, which is not typical in healthy individuals. This can be a sign that the bowel lining is producing excess mucus in response to irritation. Changes in bowel habits. A noticeable shift in bowel habits is common in IBS. This may include changes in the frequency of bowel movements, stool consistency, and the sensation of incomplete evacuation after a bowel movement. Fatigue and sleep disturbance. CSIBs can take a toll on overall well-being. Many people with IBS report feeling tired or fatigued, and they may experience sleep disturbances due to discomfort or pain. Nausea. Some individuals with IBS experience nausea, especially after eating a large or rich meal. These symptoms can be triggered or worsened by various factors, including stress, certain foods, hormonal changes, and infections. Causes of IBS. The exact cause of IBS remains unknown, but several factors are believed to contribute to its development. It's important to note that IBS is a multifactorial condition, meaning that a combination of factors likely plays a role in its onset and progression. Some of the key contributing factors include colon-gut-brain interaction. One of the most widely accepted theories is that IBS results from a disruption in the communication between the brain and the gut. The gut has its own nervous system, known as the enteric nervous system, which regulates digestion. In people with IBS, this communication may be impaired, leading to abnormal bowel movements and pain. Intestinal motility. Abnormalities in how the muscles of the intestines contract and move food through the digestive tract can contribute to IBS symptoms. In IBSD, the muscles may contract too quickly, leading to diarrhea. In IBSC, the muscles may contract too slowly, causing constipation. Gut microbiome imbalance. The gut is home to trillions of bacteria, known collectively as the gut microbiome. These bacteria play a crucial role in digestion and overall health. An imbalance in the gut microbiome, often referred to as dysbiosis, may contribute to IBS symptoms by causing inflammation, bloating, and changes in bowel habits. Food sensitivity. Certain foods can trigger or exacerbate IBS symptoms in some individuals. Common culprits include foods high in fat, spicy foods, dairy products, caffeine, and artificial sweeteners. Many people with IBS are sensitive to FODMAPs, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, a group of carbohydrates that can be difficult to digest. Stress and anxiety. Emotional stress and anxiety are known to worsen IBS symptoms. The gut-brain connection plays a role in this, as stress can lead to increased gut sensitivity and changes in bowel function. People with IBS may experience more frequent flare-ups during periods of high stress. Hormonal changes. Hormonal fluctuations, particularly in women, can influence IBS symptoms. Many women report that their symptoms worsen during their menstrual cycle, suggesting that hormonal changes may play a role in IBS. Infection. Some cases of IBS develop after a gastrointestinal infection, such as food poisoning or gastroenteritis. This is known as post-infectious IBS (PI-IBS), and it is thought to result from lingering inflammation or damage to the gut lining. Diagnosis of IBS. Diagnosing IBS can be challenging because there are no specific tests that definitively confirm the condition. Instead, doctors rely on a combination of medical history, physical examination, and ruling out other potential causes of symptoms. The following steps are typically involved in diagnosing IBS. Medical history. A thorough review of the patient's medical history is essential. The doctor will ask about the nature, frequency, and duration of symptoms, as well as any potential triggers. Rome for criteria. Rome for criteria are used to diagnose IBS. According to these criteria, a person must experience recurrent abdominal pain for at least 1 day per week in the last 3 months, along with 2 or more of the following: pain related to bowel movements, changes in stool frequency, and changes in stool appearance. Physical examination. A physical examination may help rule out other conditions that could be causing symptoms. The doctor may check for signs of abdominal tenderness, bloating, or other abnormalities. Exclusion of other conditions. Since IBS symptoms can overlap with those of other digestive disorders, doctors may perform tests to rule out conditions like celiac disease, inflammatory bowel disease (IBD), or infections. These tests may include blood tests, stool tests, and imaging studies such as an ultrasound or colonoscopy. Food and symptom diary. Keeping a food and symptom diary can help identify patterns between certain foods and IBS flare-ups. This can be valuable in determining potential dietary triggers. Treatment options for IBS. While there is no cure for IBS, there are several treatment options available to manage symptoms and improve quality of life. The best approach to treatment depends on the type of IBS and the severity of symptoms. Common treatment strategies include dietary modifications. Diet plays a significant role in managing IBS symptoms. Many people find relief by identifying and avoiding trigger foods. Some common dietary strategies include low FODMAP diet. This involves eliminating foods high in FODMAPs, such as certain fruits, vegetables, and dairy products, which can ferment in the gut and cause symptoms. Avoiding gas-producing foods. Foods that produce gas, such as beans, cabbage, and carbonated drinks, may worsen bloating and discomfort. Hydration. Staying well hydrated is essential, especially for individuals with IBS who may lose fluids due to diarrhea. Medication. Several medications can be prescribed to manage IBS symptoms, depending on the individual's specific needs. These may include antispasmodics. These medications help relax the muscles of the intestines, reducing abdominal pain and cramping. Laxatives. For individuals with IBS, over-the-counter laxatives may be recommended to relieve constipation. Antidiarrheal medications. These can help control diarrhea in individuals with IBS. Antidepressants. Low-dose antidepressants, such as TRICYCLIC. Thanks for watching. Kindly subscribe to this channel and don't forget to like, share, and comments.